earlier I talked a little bit about peace and love. Have we seen this kind of floating around on like the internet in terms of, okay, great. Just kind of curious, what information have you been able to glean from this in the moments that you have seen it?
Ice is not the answer, unlike what my dancers think. I think ice is the answer for everything.
Yes, I mean, which is what I used to think too. But once again, I think this is a nice, indication of how just healing and an understanding of healing and education is progressing and how we continue to elevate that. So peace and love, let's talk about it. So providing clarity and confidence. So when we talk about peace and love, there was rice, there was price, there was police, and now there is peace and love. I really enjoy this as a parameter to kind of follow and learn from because it considers a few different things. One, psychosocial factors, okay? It does consider some long-term consideration of injury and management. It really promotes movement optimism, so promotes finding entry points to movement, not just about a perfect exercise for somebody, but about what movements are our bodies able to accept right now and how can we move from there. Medicinal use. I am not a pharmacist, nor am I a medical doctor, but there are recommendations as to things like anti-inflammatories. And then also long-term education, just making sure that everyone is set up right from the get-go from their healing process. So I too have also seen this a lot in the internets, and I want to be able to speak to each of these parameters succinctly. Whoop. So the first is P for protect as far as peace and love is concerned. We are looking at avoiding activities and movements that increase pain during the first few days. So if you've had something like an ankle sprain, of course, we just need to offload it and we need to perhaps protect it. If you've had any sort of injury, and this is for peace and love, we're looking primarily soft tissue injuries. You're just looking at making sure you offload it so then it's not more stress than already is. And we'll say pain signals should guide progress, and this is where your activity traffic light can come in handy. Elevation is always helpful. In the article itself, it talks about how elevation is just one of those things where it's just nice to kind of help to get the swelling down. It's something that can be continued to be implemented. There's no harm in doing it. And it's just been a pretty staple part of allowing the body to recover. So, of course, if we're always like see dancers with their legs up on the walls and things like that. So going back on this idea of like elevation and kind of allowing like fluid, gravity to pull the fluid up, like people will think about things like, oh, should I use like recovery boots for like my injury and things like that? And it does help in terms of just getting the body fluids moving and allowing fluid transfer. But of course, just I would say as a general recommendation, you're going to default to your healthcare provider to see if that's appropriate for you, right? If someone's having like a knee injury or anything, you don't want to just like squeeze the heck out of them. Just cut. A is for avoid inflammatories. So anti-inflammatory medications reduce tissue healing. So inflammation is the body's natural process of healing. And if we are constantly taking things like Advil or other NSAIDs and things like that, then what happens is we potentially may even just stop the body's ability to heal. So yes, there are moments that you might want to take anti-inflammatories depending on what is prescribed by your doctor to not let the inflammatory process overload itself, right? You want healing to happen, you want swelling to happen, and swelling is the body's way of sending fluid and healing factor to a region of the body. But if it's sending so much because it's responding sort of like excessively, then do we begin to cut off things like blood supply? In those moments, then you would probably say, okay, I may need to consider the anti-inflammatory route, but it shouldn't be our first get-go because you don't want to stop the body's natural response of healing, right? I think also just as a general warning, depending on the situation, sometimes I know studios might have a medicine cabinet that's like available. So unfortunately, it's a situation that I've seen where students just had access to things like that. So they'd come out of class, come up, pop a Tylenol, go back to class with no adults around, and I'm sitting there like, what just happened? So once again, there are the policies and procedures for medicinal use, but at the same time, it's also that, has this behavior been normalized in a way to these dancers where they feel like this is just something for them to mask their pain and then just to get through it, right? It's not just about the act of taking medication as a crutch, but also just the behavior of masking pain, and that is the strategy that they have resulted to when it comes to dealing with pain. Ice, once again, is appropriate depending on the situation. Generally, we like to say within 24 to 48 hours, where you want to prevent the swelling from cutting off the blood supply or being limiting function and things like that. But ultimately, we're thinking about how do we promote healing, and that is going to be through movement. It's going to be through adding good stress. The analogy I always like to give when it comes to using ice is, how do we slow down physiological processes? And I'm talking to a dancer. I'm like, if you want a piece of, for those of us that eat meat, if you want a piece of steak to last longer, you want to slow down the physical processes. So you put it in the fridge. That's ice. So if you're trying to heal, are we trying to slow down our physical processes, or do we want to speed it up? Generally speaking, you want to speed it up. And so that's where heat comes in, that's where movement comes in, that's where motion and mobility comes in, and it helps to drive home that idea a little bit more succinctly. Once again, ice can also help numb the pain as well, so they might be feeling less pain, but that's just because we just froze the heck out of it, right? C is for compression, and once again, this can help in terms of taping, in terms of like recovery boots when appropriate. And then E for education. This is huge, and if you know us, then you know we're really big on education. So being able to emphasize an active approach to promote movement and to make sure that we're not just sitting and doing nothing. And that's in reference to both the healing site and everywhere else as well. So let's go back to our ankle sprain example. Everyone understands this. So if I'm not standing on my sprained ankle for a significant period of time, or I'm using it less, or behaviorally I'm just avoiding it, then that means there are things in the knee, things in the hip, things in the core that we have to continually address. So by emphasizing an active approach, I think it's really important to be able to say, even though we can't do the thing, we can still do many things that can support the thing. So there are 1,000,000,001 exercises in my head that I can think of somebody who can't stand on their ankle. And I think this is important too, from the get-go. If someone is having pain, they already feel like their function is limited. So how can I continue to make them feel like an athlete? Not about driving them into the ground, but I think giving them movements that they can continue to feel effort, that they are moving towards a goal, that they are not falling behind, and that they know that they're working towards something better in the future, right? Versus, here's 6 weeks in a boot, don't do anything, rest, and then once they're out of the boot, go back. So that's where you get your spike and load, right? Passive modalities, once again, can be helpful. But ultimately, we're looking at how can we get you back to movement, because the only way the body adapts, that our tissues adapt, muscles, tendons, ligaments, is through stress. How can we slowly reintroduce stress? And how your body responds to that stress, aka the activity traffic light, is going to give you, how your body responds to that stress is going to necessitate some conversation, some ebbing and flowing, and the activity traffic light is a great way to kind of look at that in conjunction with your healthcare provider, right?